So yesterday we were discussing about thrombocytopenia. Now there are several factors that can influence or that can cause thrombocytopenia. Essentially, decrease in the platelet count itself that can occur in two different ways. One is there is impairment in the production of platelets, or they can be accelerated platelet destruction. Both the ways you will have a decreased amount of platelets in your body. Okay, so the two ways through which thrombocytopenia occurs. Thrombocytopenia. You'll have different diseases for different condition. Okay, so if let's suppose there is impaired platelet production, impaired platelet production. Okay, or yeah, फिर there is accelerated platelet destruction. Now अलग अलग कंडीशन में ये दोनों हो सकते हैं. Let's suppose if we talk about impaired platelet production, कब होता? Mostly cancers में होता. ठीक है. So it will happen in anaplastic anemia, या it will happen in acute leukemia. Conditions include anaplastic anemia, it can be acute leukemia, या फिर myelofibrosis, bone marrow problems, या फिर bone marrow cancer. ठीक है. Malignancy in the marrow, या फिर a few drugs. Drugs that can cause impaired platelet production will include chloramphenicol. We studied this during tetracyclines. Then thiazides, hydrochlorothiazide is one example, and anti-cancer drugs. All of these will impair platelet production. Also, chronic alcoholism. Now, this is one way through which you can have decreased amount of platelets in your blood. Another way where destruction of platelet is increasing, that will be, now those conditions will be, one is ITP, immune thrombocytopenia. Your immune system is killing your thrombocytes, or it can be SLE, systemic lupus erythematosus, autoimmune disease again, or it can be AIDS. It can be CLL, chronic lymphocytic leukemia. Just write it, chronic lymphocytic leukemia. या फिर it can be DIC. DIC is disseminated intravascular coagulation. Disseminated intravascular coagulation, या coagulopathy बोल के भी बोलते हैं इसको. इसमें क्या होता है, all around your body there will be abnormal clots being formed. Okay, more than, way more than normal. या फिर if there is a giant hemangioma, a big clot of blood or a big blob of blood that is occurring in somewhere in your body, their platelets will tend to get aggregated, and because of which thrombocytopenia occurs. Yeah, it can be due to a few drugs as well, specifically sulfonamides, okay, quinine, and gold. Okay. It can be because of hemolytic anemia, specifically microangiopathic hemolytic anemia. Pathic hemolytic anemia. ठीक है. और इट कैन बी स्प्लीनोमेगाली. स्प्लीनोमेगाली में क्या होता, whenever the spleen is enlarging, it will cause splenic platelet pooling, meaning platelets will go and pool inside the spleen. They will go and get accumulated inside the spleen to an extent that sometimes what happens is 90% of total amount of platelets that are present in your body will get accumulated in the spleen, because of which the total amount of spleen, the total amount of platelets that are present in the blood will significantly go down, because they are getting accumulated only in one organ. Okay. Yeah, फिर if there is a massive blood transfusion, that also causes accelerated platelet destruction. Okay. So these are the conditions that are decreasing the platelets. Now there are a few conditions that cause thrombocytosis as well, increase in platelets. Now it can be either essential thrombocytosis, या फिर it can be an infection, specifically chronic infections. Okay, or it can be hemorrhage. Generally, as a compensatory mechanism, your body will start producing more amount of platelets. Post-operative stage, operative state, या फिर if there is cancer, in that platelet production will occur. Okay, या फिर after splenectomy. These are all the conditions in which thrombocytosis will occur. Thrombocytosis is increase in the number of platelets in the blood. Now, how does this correlate practically? We will check bleeding time and clotting time, sometimes even prothrombin time, to see the function of platelets. Okay, whether they are working or not, or whether your own coagulation system is working or not. Now, first of all, let's come to bleeding time. आप लोगों को इसका experiment कराए थे क्या कभी? You will have a small experiment where you take a small needle and you prick yourself with that, and you will check the bleeding time. ठीक है, ये बेसिकली क्या करते हैं, आप एक छोटा पेपर लेते, लिटमस पेपर, एंड यू विल कीप डैबिंग एवरी 30 सेकेंड्स, एंड यू विल चेक हाउ लॉन्ग इट टेक्स फॉर यू टू स्टॉप द ब्लीडिंग. उसको ब्लीडिंग टाइम बोलते हैं. ठीक है, टाइम टेकन टू अरेस्ट ब्लीडिंग आफ्टर पंक्चर, दैट इज ब्लीडिंग टाइम. टाइम टेकन टू अरेस्ट bleeding after puncture is made on the skin. ठीक है, you have to make sure that the puncture is enough for blood to flow. ठीक है, आप क्या करते हैं, एक छोटी sterilized needle लेते हैं and you will prick your finger. Once you prick your finger, obviously it will start bleeding, and every 30 seconds you will keep dabbing. ठीक है, you will take one small litmus paper, or you will take a sterile paper, and on that you dab every 30 seconds. Now you will place it in such a way that आप ऐसा dab करते हैं. For example, let's suppose this is the sheet of paper. ठीक है, this is the sheet of paper, and you start dabbing here. ठीक है, this is the first spot. Then this, आप इसके बाजू यहाँ पर 0 seconds बोल के लिख देते, meaning as soon as you prick you dab, then after 30 seconds you will do it again. ठीक है, थोड़ा लाइटर होता, then again थोड़ा और लाइटर, लाइटर, वो लाइट होते होते finally at one point of time it will stop. Okay, you will not see anything altogether, so you will keep marking. यहाँ पर 30 seconds mark, यहाँ पर 1 minute mark, यहाँ पर 1.5 minutes mark, and so on and so forth. ठीक है, normal bleeding time can range anywhere between 2 to 7 minutes, meaning it can take 2 to 7 minutes for a normal individual to stop bleeding. Again, the bleeding time will generally increase if the incision is very big, but as such 2 to 7 minutes में normal individual, normal healthy individual में रुक जाना चाहिए. If it is not stopping within 7 minutes, it generally indicates that platelet activity is inadequate. Okay, or there is a failure of vascular contraction. Generally what happens is, once bleeding is occurring or hemorrhage is occurring, those nearby blood vessels will contract, they will undergo vasoconstriction, there will be a small inflammatory reaction, there will be vasoconstriction, and because of which your body is basically stopping hemorrhage from occurring. Okay, so it can be attributed, if bleeding time is increasing in a certain patient, it can be attributed to either platelets are not working properly, or vascular contraction is not occurring properly, or both. Okay, if there is severe thrombocytopenia, if there is severe decrease in platelet function or platelet number, okay, that can occur in several diseases, like von Willebrand's disease रहता, या if the patient has thrombocytopathy, या फिर due to a due to certain drugs. For example, if the patient is on heparin or any other anticoagulant like drugs, ठीक है, or any drug that will interfere with coagulation या coagulation cascade, वो पूरे ड्रग्स ब्लीडिंग टाइम बढ़ा देते पेशेंट का. ठीक है, so you have to keep those in account. If drugs have not been given, then the patient has a problem in the bleeding. Then we have something called clotting time. ठीक है. Bleeding में you are only checking how long it takes for bleeding to stop, right? Clotting time में आप क्या करते हैं? You will again make a small incision on the finger, and you will take a small, how should I put it? इतना पतला एक माइक्रो पिपेट लेते हैं, ठीक है, कैपिलरी भी बोलते हैं उसको, पतला कैपिलरी, ठीक है. You can literally break it with a single finger, it will be that thin, ठीक है. I'm drawing it here like this, but it will be very very thin, ठीक है. And what you do is, once you have pricked your finger, you will fill this up with your blood. So what you do is, you take your finger. Once again, I'll show you the video itself, it will be easier for you to understand. ये देखो, I hope you can see. I will, even if you're not getting the audio, I will tell you what is happening. See, that fellow is first of all sterilizing his finger. Then, see, that is the capillary. If you can see down below, see, he's pricking his finger. Now he'll take that capillary, thin capillary, and fill it up. Okay, he'll fill it up to a certain extent. See, now he has filled the capillary. Okay. Now you start a stopwatch at this point, and what you do is, at every 30-second mark, you break it a little bit. You are waiting for a strand. Okay, a strand of fibrin will be seen inside the capillary itself. See, now every 30 seconds he'll keep on breaking. You'll break a small portion, you'll break it very carefully. See, you're not seeing any thread now, so you keep repeating it. You wait again 30 seconds. See, again he'll break. See, no fiber, no fibrin this thing yet. So clotting time is more than 1 minute here. Okay, every 30 seconds we are breaking. We'll again wait for 30 seconds, and I'm just skipping the video forward. Okay. See, he broke it at 30-second mark again, yet nothing came out. See now, हाँ देखो, अब break करे तो, if you can see closely, you'll be able to see a small thread-like structure. That is a fibrin thread that is being formed. That represents clotting time. That represents that clot formation has started. Okay. So this happened at the fourth mark, or the fourth time he broke it. Okay, meaning 30 second. That indicates that his clotting time is around 2 minutes. Okay. I hope you understood the video. So I'll just briefly explain what he did. He took a capillary, he pricked his finger, he sterilized his finger initially, he pricked the finger. Okay, and he filled the capillary up with his blood. Once you fill the capillary, you break it at 30 seconds interval. ठीक है, छोटा छोटा portion आप break करते जाएंगे. So here you break it again at 1 minute, then again you break at 1.5 till you see a fibrin strand. ठीक है, let's suppose 2 minutes, and now you are breaking at 2.5 minutes. यहाँ पर at 2.5 minute, what you will see is that if I enlarge this, let's suppose that is the clotting time of the patient. How you will know that it is the clotting time? Once you break it apart, you will be able to see that. One second. Oh dear. Let's suppose this is the other end of the capillary. What you will be able to see is a thin fibrin strand will be formed. ठीक है, if you saw the video, if you saw it in the video, a thin fibrin strand was being formed. That indicates that the clot formation has completed, or at least it has come into what you call full blown initiation at 2.5 minutes. That will conclude that the patient's clotting time is around 2.5 minutes. Okay, that is how you find out clotting time. Now, as such, normal clotting time is anywhere between 4 to 9 minutes. Okay. In some patients, it is slightly earlier as well, but generally, on an average, 4 to 9 minutes it will take for a patient to have clot formation in their blood. Okay. Now, there are a few conditions in which clotting time can increase. Okay, abnormally increase. Now, that will happen either in hemophilias. Hemophilia matlab the patient has a bleeding problem. Okay, they will not clot properly, their blood will not clot properly, especially after injury, or sometimes even without injury there will be a lot of hemorrhage occurring, and that hemorrhage will not stop. Okay, generally happens when coagulation factor 8 and coagulation factor 9 deficiency is there, हेमोफिलिया, ठीक है, उसमें क्लॉटिंग टाइम बढ़ जाता, या फिर देर इज वर्टिकल देर इज अ डिफेक्ट इन various factors that are involved in intrinsic and common pathway clotting cascade. I'll show you what is clotting cascade in a bit. या फिर there is presence of drug in the blood. ठीक है, if the patient is on heparin, that is also one reason why clotting time will increase. Heparin will not let clot be formed easily, right? So that is about clotting time. Now we have another way of assessing clotting time, that is called prothrombin time. यहाँ पर आप specifically क्या करते हैं? Prothrombin time में you do this in a machine rather than doing it like this, and you are trying to assess how well the patient's extrinsic pathway and common pathway are working. तो अगर आप clotting cascade देखें, I'll show you the one second image for clotting cascade. See, this is how clotting cascade looks. This is what happens. You have an intrinsic pathway, you have a tissue pathway, or extrinsic pathway. Both of them will combine at one point of time. Common pathway, both of them will merge together. There will be common pathway. Finally, you will end up having a fibrin clot being formed. ठीक है, यहाँ पर this is the goal. Fibrin clot formation. अब जो sequence में आते हैं, that is important in our prothrombin time. Prothrombin time is basically the time taken for your clot to clot citrated plasma. You will add a little bit of citric acid into the plasma, and you will check how long clotting is taking place. Okay, this is again in the presence of calcium ions as well, because there are several factors. You will have thromboplastin, which is tissue factor, calcium ions. यहाँ पर calcium ions mentioned नहीं है. I will write down wherever calcium ions are not mentioned here. This will show you how well the patient's intrinsic and extrinsic pathway are working. So you can dial down specifically, okay, this is not working or this is not working. Rather than telling, okay, the patient has clotting problem in general, that we know. We want to dial down specifically, क्या काम नहीं कर रहा, so that we can rectify that. Okay, now as such what happens is, look here, अब tissue factor यहाँ से important आता. Tissue factor जो है, it will convert activated 7 factor, it will help activated 7 factor to convert 10 into activated 10. ठीक है, it will also happen using 9A. A is activated form. ठीक है, ये each factor which is present, clotting factors, they will be present in two forms. They will be present as a normal form, inactive form. Let's suppose it is 11 ऐसा. Then you have 11A. A का मतलब it has been activated. ठीक है, now as you can see, 10 is being converted into 10A using both 7A and using 9 and 8A. The function of 10A as well as 5A, नीचे से 5 is being converted into 5A. Prothrombin will get converted into thrombin. ठीक है, the inactive form gets converted into active. 2 will get converted into 2A, that is prothrombin is 2. ठीक है, 2A will help in breaking down fibrinogen. यहाँ पर क्या हो रहा, टिश्यू फैक्टर एंड 7A के टाइम पे यहाँ पर एक कैल्शियम आ रहा. सो आई जस्ट यूज orange color dot for calcium because it is harder to write on this. Wherever there is an orange color dot, that represents a calcium ion. ठीक है, one second. So यहाँ पर calcium ion आता. ठीक है, that is one place where 7A and tissue factor along with calcium ion, you will also have a phospholipid complex that are activating factor 10. ठीक है, factor 10 into 10a. You will also have 9a that is helping conversion of 10a into, so यहाँ पर भी calcium आता है आपको. ठीक है, converting 10 into 10a. This is intrinsic pathway से and that is extrinsic pathway से. This part is extrinsic, the right one, and this left part is intrinsic. यहाँ पर common बन जाता, where activated 10 factor जो है, यहाँ पर भी you will have calcium ions. ठीक है, helping conversion of prothrombin into thrombin. So you have factor 5, you have calcium, you have factor 10a, all of them converting prothrombin into thrombin. Now once prothrombin is converted into thrombin, thrombin will help in breaking down fibrinogen specifically. Fibrinogen will be converted into small fibrin molecules. These fibrin molecules will be polymerized. ठीक है, polymerized मतलब उन लोगों का नंबर बढ़ाते. That in a way it is also multiplication, polymerization. ठीक है, you that polymerization reaction is occurring using factor 13. Factor 13 is converted into factor 13a through thrombin, and that in turn factor 13a will make sure that polymerization of fibrin occurs. Once polymerization of fibrin occurs, there will be several strands of fibrin like this. ठीक है, these strands are helping in clot formation. Let's suppose यहाँ तक I'll switch to this thing. Let's suppose the patient has a wound like this. ठीक है, on the surface there is a tear like this and यहाँ पर fibrin के strands आ रहे. So let's suppose I am drawing fibrin with purple. ठीक है, ये fibrin strands आके क्या करते, they will at one part of it is they will attach with platelets, another part is they will make sure that these two ends are attached, and these fibrin strands will literally pull those two ends together, so that this जो tone end है, अब ये स्किन में टेयर हो गया यहाँ पर, वो टेयर को आप क्या कर रहे हैं, लिटरली फाइब्रिन स्ट्रैंड्स आर कमिंग अटैचिंग टू बोथ द एंड्स एंड पुलिंग देम टुगेदर, बिकॉज ऑफ विच योर स्किन इज लिटरली कमिंग क्लोजर. इट इज डिक्रीजिंग द साइज ऑफ द वुंड. एंड यहाँ पर क्या होता है, अल्टीमेटली यू विल हैव प्लेटलेट्स कम इनटू पिक्चर. More and more platelets will come, start clumping. Sometimes you will have platelet fibrin complex as well, so you will see platelets and fibrin here. ठीक है, यहाँ पर platelets you will have a proper clot formation. This is a clot formation. ठीक है, that is how prothrombin time is measured. Generally for citrated plasma it takes around 11 to 15 seconds. ठीक है, that is the normal PT. आपके केस शीट में you must have seen something called PT-INR. ठीक है, that represents prothrombin time and internationalized ratio. ठीक है, sometimes you will have APTT as well. ठीक है, that also represents prothrombin time but at a different schematic. Now anyway, in there are a few conditions in which prothrombin time will increase. Those conditions again are conditions that are affecting clotting time as well. Let's suppose the patient has they are on oral coagulative therapy. Let's suppose they are on heparin or warfarin, anticoagulant therapy, sorry. They are on heparin or they are on warfarin or they are on any other drug that is inhibiting coagulation. या फिर they have liver disease. You saw that clotting cascade heavily relies on the factors that are clotting factors that are mainly produced by your liver. Okay, several of them are produced by your liver. If there is liver disease or there is obstructive jaundice, those factors are not produced or they are destroyed. That is also one reason why clotting cannot occur. Or if it is hemorrhagic disease of a newborn, या फिर the patient has DIC. DIC, I just told you, is a condition in which the patient will have blood clots all over the body. ठीक है, that is also when prothrombin time will increase. They will have unnecessary clot everywhere other than where it is necessary. ठीक है, DIC में without any cause आपके all over your body blood clots are being formed, because of which let's suppose there is hemorrhage at a certain spot. ठीक है, let's suppose at the lower limb someone has hemorrhage, internal or external. Clot will not occur very easily in that. Okay, because clots are being formed everywhere. There are not enough amount of platelets available to clot wherever there is injury. Or it can be a congenital deficiency of factors. Generally the factors that are deficient will be factor 2, factor 5, factor 9 and factor 10. They can be either in combination or they can either be a single factor that is missing. Okay, in clotting cascade one is dependent on the other. If any one of them is also not present, clotting cascade will not work properly. Okay, that is why it is called a cascade reaction. One reaction will help the other, then that reaction will help another one. So that is about clotting time and prothrombin time. Hope you understood that. Now coming to blood grouping. Blood grouping, you already know that there are four major blood groups. We have A, B, AB, and O. ठीक है. Now the blood group ऐसा assign करते हैं, each RBC, let's suppose I have a person who has A blood group, ठीक है, उनके RBC के ऊपर there will be certain antigens, special antigens, ठीक है. Let's suppose I draw that antigen like this. Let's suppose they have purple antigen. B person के पास, जो the person who has what you call blood type B, they will have a different type of antigen. For example, let's suppose they have this type of antigen. That is one of the reasons why you cannot intermix blood. At least you cannot mix A and B. You can also you cannot also give AB. Only O is acting as a universal donor. You will understand in a bit. Generally, what happens is people with blood type A, they will have what you call antibodies for B. Okay? They will have anti-B antibodies. People with blood type B, they will have anti-A antibodies. They will have the antigen B. These are antigens. ठीक है. एंटीजेंस को ब्लड पिक्चर में अग्लूटिनोजेन भी बोलते हैं. ठीक है. अग्लूटिनेशन इज अ रिएक्शन ऑफ क्लंपिंग. अगर मैं पर्सन बी का ब्लड, लेट्स सपोज समवन हैज ब्लड ग्रुप बी, आई ट्रांसफ्यूज दैट इनटू अ पर्सन हु हैज ब्लड ग्रुप ए, देयर विल बी सिवियर क्लॉटिंग. ठीक है. दैट रिएक्शन और क्लंपिंग रिएक्शन विल बी कॉल्ड अग्लूटिनेशन. नाउ द एजेंट दैट विल कॉज अग्लूटिनेशन इज कॉल्ड अग्लूटिनोजेन. यहाँ पर सेम वे एंटीजन जैसा, एंटीजन इज एनीथिंग दैट कैन ट्रिगर अ इम्यून रिएक्शन, राइट. एनीथिंग दैट कैन ट्रिगर अ अग्लूटिनेशन रिएक्शन, उसको अग्लूटिनोजेन बोलते हैं. यहाँ पर एंटीजेंस आर नथिंग बट अग्लूटिनोजेंस. अग्लूटिनोजेन. ठीक है. सिमिलरली एंटीबॉडी विच विल वर्क अगेंस्ट दिस एंटीजन will be called agglutinin. ठीक है. That's simple. If you look at the different types of blood picture, I will show you. One second, one image is there. इधर है. Yeah, ये देखो. Person with blood group A, उनके पास एंटीजेंस A टाइप के रहते हैं, एंटीबॉडी एंटी B टाइप ऑफ एंटीबॉडी रहती. Versus if a person has blood group B, they will have antibodies of type A, whereas they have antigens of type B. Person with group AB, they will not have any antibodies, because of which they can accept blood from anyone. ठीक है. They can accept blood from O, they can accept, they generally take blood from O because A अभी उतना अच्छा काम नहीं करता, but they can take, generally O use करते. They will have both the types of antigen. Then you have blood group O. Their RBCs will not have any type of antigen altogether. That is why they can what you call give their blood to other people. ठीक है. इन लोगों के ब्लड में एंटीजन नहीं रहने की वजह से दे विल नॉट कॉज अ रिएक्शन इन एनी अदर टाइप. ठीक है. बिकॉज दे डोंट हैव एनी एंटीजन, देयर इज नो अग्लूटिनेशन रिएक्शन. आई होप यू गाइस आर फॉलोइंग. Group A will have type B antibody, meaning if I give if I give blood group B in a person with blood group A, there will be antigen B, antibody B. That will be the reaction. Okay. If I have a person who has blood group B who has anti-A antibodies, okay, anti-A antibodies, that will react with A antigen. So whenever I give A blood in B blood group person, there will be a reaction. AB blood group people do not have any antibodies. That is why they are able to receive very easily. They will have both the types of antigens but no antibodies. Whereas blood group O, they will have both the type of antibodies but no antigen, meaning they do not trigger any agglutination reaction altogether. ठीक है. खाली antibody है, antigen नहीं है. All right. That is the difference. All right. Now there is right. There is another factor called rhesus factor. Okay, we'll start discussing about rhesus factor and cross matching in the next class. Okay. I don't have enough amount of time, so I hope you understood.